Health centers and dispensaries will be the most sought-after health institutions when it comes to child delivery, or at least for those women who will want to access the waiver on maternal health care. And so Kenyatta and Pumwani hospitals will have to take a backseat, as they will only help deliver children in the event of complications. However, do the health centers really have the capacity to do so?
I think it is an issue of perception. Right? Because those health centers were not working several years ago, so most people think they are not functional. But if you look at the health centers in Nairobi, Kayole, Dandora, they are now operational. So, but a lot of women do not know that those facilities are actually now functional.
Director of Public Health, Dr. Sharif Shanaz, says it is possible for mothers to deliver their babies in the presence of healthcare practitioners without paying a cent in 100 days' time, as promised by the President.
We compensate the hospital for the revenues they will have lost from which they were getting from maternity services and maternity charges. So we'll compensate them for that, so they do not charge.
Inefficiency on the part of the hospitals will also be reduced, as the government will shift its approach from input basis to output basis, whereby they pay per service given to the members of the public.
If you do not compensate them, right, then they will find other ways of extracting money from pregnant women. So somehow we have to compensate them. If you don't, then there will be unofficial charges which will come in, and that's one thing which we do not want, is under the table charges.
In the long run, the government intends to ensure that every woman has insurance that will cater for the service when they require it.
We'll make sure we live up to this executive order. It is an order from the President, and so we will do it.
Well, there you have it. It is indeed possible to have free maternal health care for all Kenyan mothers, and government officials are keen on delivering on this, because it's not only in line with the President's promise, but also in line with the international commitment under the Millennium Development Goals. Waweru-Mwangi for JSO at 7.